Fibrinolytics or thrombolytics, they activate the conversion of plasminogen to plasmin. Plasmin breaks down or lyses or dissolves existing clots. What is plasminogen? Plasminogen is an inactive precursor of the enzyme plasmin that's present in the blood. And plasmin is an important enzyme present in the blood that breaks down clots. The therapeutic effect of fibrinolytics or thrombolytics is basically breaks down or lyses clots or thrombus. The natural fibrinolytic system within the blood takes about several days to break down a clot, so fibrinolytics or thrombolytics work a lot faster than that. The reasons why we give fibrinolytics or thrombolytics: presence of MI with specific criteria, thrombotic stroke, and they have to meet a specific criteria as well, DVT or deep vein thrombosis treatment, PE or pulmonary embolism treatment. Some precautions: blood dyscrasias, clotting disorders such as hemophilia, any recent surgery, history of intracranial bleeding or history of active bleeding or current active bleeding, and concurrent use of other drugs that affect clotting. So contraindications or reasons to not give thrombolytics: definitely active bleeding, either visible or occult. So either it's obvious or it's not. So that's contraindicated. Some side effects of thrombolytics include bleeding. So the most common can be internal and or superficial bleeding, nausea, vomiting, hypotension, and cardiac dysrhythmias. Some nursing actions or nursing interventions: so continuous assessment for active bleeding, again either visible or occult, appropriate drug dosing, and a huge part is also patient education. A very important component is ensuring safety and prevention of fall, as this can cause life-threatening complications from hemorrhage or bleeding. Labs to monitor: CBC, hemoglobin and hematocrit, and platelets. We also monitor fibrinogen, fibrin protein formed during the clotting of blood. Fibrin degradation produces FDP, substances that stay in your blood after you dissolve a blood clot. D-dimer, D stands for the two D fragments of the fibrin protein. And as mentioned earlier, patient education, regarding the treatment, safety issues, and when to call for help. These are examples of thrombolytics from the tissue plasminogen activators or TPA. So we have activase or alteplase. This one is one that you have to remember. Ritavase or retiplase, TNKase or tenecteplase, and we also have rabikinase or streptokinase or STK. Some general nursing actions to remember is, again, assessing. So details about the pain, precipitating and relieving factors in the site, also preparing for treatment, especially for possible cardiac interventions. And also, if we know that the patients will need thrombolytics, a lot of the times we try to do the invasive procedures ahead of time, such as ensuring that we start all the IVs needed, starting the Foley catheter, because then if we do it after giving the thrombolytics, that can cause large amounts of bleeding that may be hard to control if we don't do it before starting the medication. So additional general nursing actions include patient education. We need to educate the patient regarding risk management and the disease process, and we need to inform them or educate them regarding the treatment. So medication actions: how does the medication work? Some precautions, some of the labs that we're monitoring for the patient when they're receiving these medications. And also, it is important to educate them if they're going to need cardiac intervention, when to follow up, and when to call their doctors. Also, when to call for help while they're still at the hospital.